This is the palpation portion of Riot's physical exam. Here it is thoracolumbar junction. He's very painful. You notice the muscle spasm there. As we come down, he's also going to be painful over his sacrum or his pelvis. This is the neck palpation of Riot's exam. You notice here we're pulling his head down and to the side, and he's not balking or resisting at all, so he's fairly comfortable in his neck. No pain on pressure along those vertebrae either. We're also going to come down his back a little bit again, and you're going to see between his shoulder blades there he's uncomfortable. His ears went back a little bit. He's going to have the muscle spasms in his back again as we come down. This is minimal pressure that we're applying, just enough to notice the inflammation and the muscle spasms from the discomfort and the abnormalities in his spine. Here we're right at his thoracolumbar junction where his thoracic vertebrae meet the lumbar vertebrae. Again, between his shoulder blades. With him, he's very stoic. He sat down. That's one of his signals for discomfort and pain. You have to be very careful with some of these dogs because they don't have many pain signals. Here we're going to move on to palpating Riot's left shoulder, which is the one he had more lameness in on the moving exam. So we're coming down, I'm just palpating his muscles. Here we're going to flex all of his joints, and he's pretty comfortable. He has limited extension of his shoulder, and here you're going to see that he has limited flexion of it and extension of his elbow. He should be able to get that flush with his rib cage. Here we're looking for muscle pain, swelling. He does have some swelling in there. You notice that he's turned his head to the left towards us during that palpation. That was one of his indicators that he's painful. Here we're moving on to show you how he distributes his weight to deal with his lameness and his discomfort. We're going to move down to his legs, and you see that he places his right foot backward to distribute his weight more evenly so far as he's concerned. We're going to move his left leg backwards, and he'll actually leave it there for us. He just redistributes his weight to deal with the pain and discomfort. Here we're moving on to the palpation of Riot's hips and knees. This is his left side, and here we're going to flex his hip, and he's fairly comfortable. We're going to extend his hip, he's less comfortable. We're also going to palpate his left knee, which he's more lame on. We're looking for signs of a cruciate tear, which is visible with drawer motion, where the femur and the tibia move in ways they shouldn't. He has minimal movement there, but a little bit of laxity. Here we're abducting or moving his hip away, and he was a little limited there, but here especially with the extension of his hip, you see him pull his leg forward. That's him doing that, not me. He has muscle spasms in his back, and part of that is referred back pain during that examination. Here again, showing you that that was referred back pain, but it is still discomfort in that hip for him trying to extend it. We're looking here around the muscle bellies around the hip. We're going to roll him over and do his right side now. We're going to focus more on the hip than the knee because he's more painful in his right hip than his right knee. We are still going to check for drawer sign. He doesn't have any there, even the minimal amount he had on the other side. He's fairly comfortable as well. Here he's far less comfortable. He actually vocalized during the exam, which is remarkable for him. He has very few pain signs. You notice he has very limited extension. Again, we're checking for pain along those muscles. He's much more swollen up along that hip, which is what I'm feeling there. It's, you're not able to see it, but I'm feeling the swelling and the water and the fluid there, the heat as well, and pain. You're going to notice that he's fairly uncomfortable. His leg actually starts twitching there while I'm palpating those muscles. These things are what you want to look for. He has very limited ability to abduct or move that hip away from his body. We get a little more as we warm him up, but still very limited mobility there. With these guys, you really do have to look for very specific signs when they're very stoic. Here, again, showing you that his legs begin twitching. He moves his head a little bit, and those are just his minimal signs of pain.